Next, we'd like to have our sponsor, the Medical Center of Dublin over on Hillcrest, Dr. Garner.
I've been around COVID a lot lately, and it's really interesting. Our health department is by far the best I know of in getting the results and the results back. I've had COVID, my wife's had COVID, but I do want to thank Thomas. And Thomas and I grew up together. We both went to church together, in the same office together for years, but we do appreciate the health department and all they're doing in the hospital. We're giving the COVID vaccine now, and the health department will be. We're not in competition. I don't care where you go. We want to get the vaccine out. I think it's very important. I think it's going to be a lifesaver. And we actually have a program we're starting. It's called the Lifesaver program, and we're renting a building. We are giving the vaccine in the office to healthcare and certain people, but we are opening a office across the street which is dedicated. We are going to have we do have a freezer where the Pfizer vaccine can be, and also just the Moderna and the Pfizer is what we'll be having. I don't know, the health department, are y'all giving the Pfizer or yet? Or?
We're solely doing
Moderna, that's what we're doing right now. But anyway, I do want to put a plug in for anybody that's had COVID. Convalescent plasma is needed. The hospital needs that. You have people that are extremely sick, and it's a life changer. Don would tell you that. And I think a lot of people are having to wait 4 days or 5 days sometimes to get this convalescent plasma, and it does change things. They have other drugs they're using, but I think that's one of the things that makes the most difference. COVID is really rampant out there. I was telling Thomas today that Georgia is #1 in the spread of COVID right now, and it's at the top of the list. The RT value is the highest in Georgia of any state, and it wasn't 2 months ago. It was one of the lowest states. So it's out there. We need to get the vaccine out, and I think it'll be a life changer. And one thing, when you ever have a bad thing happen to you, you can always make it good. And I think that we need to look at COVID as pretty bad. It's very bad, but I think also it can bring the best out in people, and I've seen it do that quite a bit. In Mark it says, Jesus said that he came not to be served, but to serve and give his life a ransom for many. And I like that quote, and this is an opportunity to serve, and I think that's what we need to think about more than anything else at this time. Get the vaccine. Don't care where you get it, I just want you to get it. Thank you.
I certainly plan on getting the vaccine as soon as it's available to us middle-aged guys. So.
From humble beginnings with a desire to serve the Dudley community, Bank of Dudley has grown to 5 locations, serving Lawrence, Twiggs, and surrounding counties. Serving our community since 1905, the Bank of Dudley is looking forward to its 2nd century of community banking. Drop in today to any of our 5 locations: Jeffersonville, Dudley, East Dublin, Veterans Boulevard, and downtown Dublin. Bank of Dudley, member FDIC, and an equal housing lender.
You want to acquire real-world skills instead of student loan debt? OFTC gives you an opportunity to succeed in a safe and caring learning community with flexible classes on campus and online. In just 2 years, you could be ready for a career in a lucrative field that you love. Whatever lies ahead, education and skills training from OFTC can give you the confidence to succeed.
Oconee Fall Line Technical College. Think differently about college. OFTC is an equal opportunity institution.
Imagine a life-changing injury. Imagine the fear and unknown. The Houston Clinic Sports Medicine Team, the only physicians in the area with advanced certification in orthopedic sports medicine, treats sports injuries with innovative techniques. The Houston Clinic has helped nearly 1 million athletes live without pain. Imagine getting back in the game. Imagine the best game of your life. the Houston Clinic Sports Medicine Team.
Let's give a warm welcome to Dr. Thomas Kraft.
First, I'd like to say good morning to everybody and just say thanks for the chance to speak to this group. I will say that this is probably the largest group that I've been involved with outside of maybe a couple of church meetings when things were not so bad. So first of all, I just want to say thanks for the opportunity, but I also want to say thanks for everybody being dedicated to wearing your masks and doing the right thing. So I appreciate that very much. I also want to say it's very hard to follow dynamic speakers, and I apologize for not wearing a wig or a costume or something along those lines, but I'll try to at least give you some information that's helpful. Again, as Steve said, I was involved in private practice for 20-something years and involved in the treatment side of things, and I've moved over to the public health side of things. So my presentation today will be mostly, a public health presentation. But again, this is a public health emergency, and it's the first time probably that many of you even knew much about public health at all, because public health is always kind of in the background. But unfortunately now we're at the foreground, and trying to educate people as much as we can and trying to do what we can to put an end to this pandemic. So I'll get started, and at the end probably take some questions, but I may rely on some of the other authorities in the room to help answer some of those questions too. I appreciate the partnerships that public health has had through this whole thing. My former group is involved in vaccinating the community, and they've also already helped us get healthcare workers vaccinated. The VA Medical Center and Fairview Park Hospital jumped on the bandwagon to get Pfizer and get it here first, because that was the harder vaccine to get, and jumped on vaccinating their staffs and jumping into vaccinating other people as well, and have been great partners. So I really appreciate those partnerships and kind of wanted to plug them, as well as other partnerships in the room. I couldn't name everybody that's been helpful to public health from a support standpoint, from just an outreach standpoint. We've had partners in the room who've done a great job reaching out for information to educate their workforces and are already anxious to get people vaccinated. So I appreciate the proactive stance that so many of you have taken as well. So I'll just move forward, and then we'll do some questions at the end, and I hope I do this okay. Can't talk about a pandemic without kind of at least starting with the then and the now of the pandemic. And I kind of compare the beginning and where we are now to the difference between the phone on the left and the phone on the right. When this pandemic started, we had no idea where we'd get and how fast things would move. And I just thought that was a good symbolism of how fast things have changed. Just to give you an idea of how things started, I'll never forget Friday the 13th of March. It did have to happen on a Friday the 13th, but that's when we were called to begin our response, and shortly after that is when we began to have cases. But around here is where we had that first really scary, what I now call a bump or a ditzel. But this was our first little surge through March and April, and everybody was terrified here. And our first little blurb, and then we leveled off through April and May of the early part of spring. We made some great decisions. But anyway, this is state numbers and kind of what happened on a state standpoint. Things not so bad. But we got to June and summertime, and people were out beginning to vacation, and the numbers started to go up again, and everybody panicked. And we thought that was bad. But to see where we are now compared to that, this is, and I apologize, I had to do my own slides. I'm not very good at it, but I hope you can see them from the back. But that first that I showed you was this part of the process, just here up to this point. And we were scared to death when this little ditzel happened going into the summer. But we moved up, had a very robust first spike, and had, case rates in Georgia of, 3,000 or so during that time. Made real aggressive campaigns to fight what was going on. But really the big thing that happened is that summer went away and people's lives got a little more organized. Social distancing became a little more of an issue. We really pushed masking, and things happened to pull this back down going into the end of the summer and October. And then we got into our holiday season. And so here you see the post-Thanksgiving spike, and here you see this is going into Thanksgiving. This is post-Thanksgiving going into Christmas. This is our old ditzel. These represent falls off in testing. because we didn't test as much over the holidays. But you can see aggressively after every holiday where there were lots of family gatherings, here being Thanksgiving and boom, and here being Christmas and boom, and we're climbing now real steadily, and I'll give you some numbers. But I just wanted to let you see the drastic difference between the first little part that we thought was so bad and where we're really at now as a state. And these are our local numbers, I say numbers, a graph to show you what's happening locally. This is South Central Health District numbers. Again, just showing you how our local pattern has kind of done the same thing. Little dips will begin with, the summer bump, and then Thanksgiving and Christmas. So our local district has really followed state numbers and state trends. Just to give you a little idea and this new weekly update just came out last night. I didn't have time to change it. But this is just the week of Christmas to the end of the year, New Year's Eve. And these are numbers of tests that we've done in just our South Central Health District. This is not just public health testing, although we do a lot of testing. But these are numbers that get turned into the state from all of our other testers, private practices, and urgent cares. But the thing that's important to see is, out of the numbers of tests that we do, and they were very limited over Christmas holidays, that was probably hospitals and urgent cares specifically. But we try to calculate out of that percent positive testing rates, and they're not really accurate when you have small numbers of tests. But over the week of Christmas to New Year's, we had a percent positive testing rate just based on PCR testing of about 17%. If you throw the numbers from antigen in there, antigen testing, those numbers probably jump up to 22% positive testing rates, which is where the state is now. So basically, statewide, about 1 in every 5 tests that are done are positive. And that lets you know how much disease we have roaming around in our neighborhoods. This is a graphic representation I actually borrowed from Lance Jones, who follows our numbers and kind of graphs them. But these are our 14-day testing rates that, or positive rates that, I'll take that back. These are 14-day case rates that have happened in our community. This was, again, back in the summer. Our spike here got up to about 380 cases in 14 days as a maximum number, but fell off really nicely. And we probably got a false sense of security. But this is right at Thanksgiving. And our numbers had fallen down to, in South Central Health District, Lawrence County, only 117 cases in 14 days, right around Thanksgiving time. And so people, even though we knew things were moving higher in other areas, I think people had a false sense of security about how comfortable they could be doing gatherings and all. We tried to put out, big pushes. But post-Thanksgiving, due to Thanksgiving gatherings and maybe just not being as aggressive as we should be, our 14-day case rate up until last week had gone from 117 cases in Lawrence County over a 14-day period to 780 cases in 14 days, which is very dramatic for that short a period of time, about a month, and even already twice as high as the highest point we had before. I will say this last week doesn't look quite as bad, but some of that represents a fall off in mass testing. I don't think it represents necessarily that things are truly better, but just that because of having to work towards vaccinating, we've not been able to test in high volumes. And I don't know if people realize, but with just the Lawrence County drive-through testing site that we've been doing daily, we actually did Monday through Saturday for a long time, and my people were threatening to quit. And we dropped it back to Monday through Friday and dropped hours a little bit. But we actually do just at that one site anywhere from 350 to 500 tests a day. And so you get a really good sampling. And I'll brag on my team a little bit. Actually, for the longest time, Lawrence County was the best tested county per capita in the state of Georgia. And then Fulton got mad about it and started doing more testing. So, my team's done a really good job of really trying to reach out to the community and provide testing along with everybody else who's doing that as well. But we are having to pull back as we move towards vaccination. I hope you all will be patient with us. I just don't have enough warm bodies to do both mass vaccinations and mass testing to the degree that we were doing it. But we are looking into the possibility of trying to arrange for some, what we call a Spock in the Box team to come in and help us out as we get focused on vaccination. And I'll try to keep everybody posted about that as we can arrange it. Just to give you an idea, this is our district report that we put out once a week. But just to let you know where we were last week, when we started this week, ooh, wrong button. We were already in our district, which is a 10-county area, at almost 11,000 cases. We've actually passed 11,000 cases now in our 10-county area, with more than 7,500 of those being the PCR test, but 3,300 of those being antigen tests. And what we're seeing more now is that as antigen testing becomes more available, people are getting tested more with that test. These numbers are growing, and so as you look at maps and look at data, pay attention to whether they're just reporting PCR data or total data, because if you just look at PCR testing data in our area, it can give you a false sense of security. It's still bad just to look at PCR data, but it's really scary to look at what I think is the truest indication of what's going on, which is data that includes both PCR and antigen testing. And again, this is just some interesting data, but data that first graph that Lance fixed came from. I won't tarry over that. Everybody's really here for COVID-19 vaccination updates. So I wanted to move forward and just tell you a little bit about the vaccines and a little bit about what's coming, and then try to answer some questions. And I apologize, some of these slides are dated and they're just to help me talk. This is the 2 vaccines that are available. This is actually when they were candidates, but they're not candidates anymore. They're both under emergency use authorization now and actively being used. But we currently have the Pfizer vaccine and the Moderna vaccine that are available in our area and across the state. Pfizer came out first, about 2 weeks ahead of Moderna. It's difficult to deal with. It requires a lot of complicated, very cold storage to minus 70 degrees Celsius. Most places don't have that capability, and our health departments did not, so we had to wait on the Moderna vaccine because of the way the state was allocating it. So we had partners that got that and got it quickly and got it started. And then the Moderna vaccine came out about 2 weeks later, and that's what we're giving through the public health system. Some places, I think Fairview Park and the VA, are y'all doing exclusively Pfizer? Will that?
We're exclusively
Yeah.
Pfizer.
And
we're exclusively Moderna, but we have the capacity for Pfizer. And
okay.
As soon as they offer us Pfizer, we'll be doing that as well.
Okay, I apologize. And then Medical Center also is doing Moderna vaccine, but has capability to get Pfizer, and we're actively trying to help them get that. And then our system is doing Moderna vaccine. So we have good coverage with both vaccines. There will be more that become available, but these are the ones who are approved now, and will get us started. Just something to note, if you get the Pfizer vaccine as a first dose, your second dose is given 21 days later. If you get the Moderna vaccine, your second dose is given 28 days later. So you should be given a vaccine card when you get a vaccine with the date of vaccine, and you'll have to kind of keep up with that, but that's important to know. And it's important to know right now too, that if you get one vaccine as your first dose, you don't get a separate vaccine the second time. You have to stay with Pfizer or stay with Moderna. They don't recommend cards just because data is not there to support how well they work. As far as Pfizer vaccine goes, it's a very efficacious vaccine. Both of these vaccines rely on messenger RNA technology. Both have, Pfizer has about 95% efficacy. Pfizer had about 36,000 people in their study. And of all the people who got COVID during their study, they had 168 cases of COVID that developed in their placebo group, and only 8 cases of COVID that developed in people who were vaccinated. But it showed very good efficacy across all ages and genders and races and ethnicities. They learned that Pfizer may help prevent the severity of cases based on the number of severe cases that happened in the placebo group versus the group that was vaccinated. Very little side effects with Pfizer, only 3.8% fatigue after the second dose, 2% headache after the second dose. But again, this is in the smaller study. Those numbers will be updated as more of the population gets vaccine. It's important to remember too for Pfizer that it's only approved for people 16 and older at this point. The studies included only people 18 and older, but Pfizer felt very comfortable dropping down to age 16. Moderna, on the other hand, again, has very similar efficacy, 94.5% efficacy, very similar numbers as far as COVID cases that occurred in the unvaccinated versus the vaccinated group. Although in the Moderna study, all of the cases that were severe occurred in the unvaccinated group. So if somebody had gotten vaccine in the Moderna study and then developed subsequent COVID, their case was considered mild and no severe cases happened in the Moderna. They report a little higher numbers in side effects. That's kind of akin to what you might see if you get the shingles vaccine, which some people may be familiar with. Some people react to that vaccine a little bit more. But again, nothing to be concerned about. Moderna only approved their vaccine for people 18 and older. As far as vaccine safety, I just wanted to make a comment. People worry about it. People are concerned. Everybody's hesitant. But a fact that I came across just a couple of days ago, well, January the 6th, I don't know if you're familiar with Amber Schmidtke or not. She actually used to work with Mercer School of Medicine and was an epidemiologist and taught in their medical school, but she's moved during the pandemic out to Arkansas and is working with a facility there, but still follows and tracks our numbers every day, does really great reports. Because she's not connected, she can be both politically and whatever honest, and she puts out some pretty good data and assessments. She's critical where she needs to be, and she can get away with it. So. But one of the things that she reported, which I thought was great, it says, so far with vaccination, there have been 29 people nationwide with serious events associated with an ER visit out of 4.8 million people in the United States so far who've received the vaccine. So if you look at 4.8 million people receiving one of these two vaccines so far, and only 29% of those people having side effects significant enough to go to an ER, maybe an anaphylactic reaction or severe shortness of breath. Some of these wind up being panic attacks even. But of those people, 29 went to the ER, and the percentage of people that had to go to the ER out of 4.8 million is 0.000006%. So, now that the test group has moved out to 4.8 million people, I feel like that supports being very, having very secure feelings about getting the vaccine and feeling very safe about it. Just other important safety facts that I wanted to mention. Again, people worry about the small number of people involved in trials, but the Pfizer trial included 36,621 people. The Moderna trial included 30,350 people. Those are good-sized trials, especially for research that happened quickly. So they're not small trials at all, and bigger trials than a lot of medicines get early on, bigger trials than other vaccines have gotten going on. So a real robust set of trials to approve these vaccines. Other people worry about the safety and this messenger RNA technology that was used, but messenger RNA technology was actually discovered about 30 years ago. It's not new technology. It's been around forever. It's been studied for vaccine purposes solely for nearly 20 years, and it's studied extensively for cancer research and all as well. So it's technology that's been known about a long time. Moderna, as a company, most people hadn't heard about it, but it's actually a company dedicated to messenger RNA technology, and that's what the modern RNA Moderna name comes from. So it's a company that specializes in that technology. So for 20 years, they've been trying to develop vaccines using messenger RNA technology because they know it works well. Scientists have been working on a coronavirus vaccine specifically since SARS and MERS outbreaks happened several years ago, and you may remember those, I don't know, maybe 8 or 9 years ago. The trouble with not having a vaccine there is that there were early phase trials in place, but funding dried up because those didn't turn into anything big. But this pandemic obviously is affecting the world, and the United States specifically and terribly right now. So funding has been the major thing that has been present to allow this technology to advance so quickly. Just to let you know, there are early phase trials that started using this technology, trying to come up with flu vaccines, trying to come up with Zika vaccines, rabies vaccines, and CMV or cytomegalovirus vaccines, which all need updating. Some of these are live virus, and we all know the flu vaccine, you have to get it every year. This new technology would maybe allow that not to be the case. So I'm hoping that this vaccine will become a model for updating other vaccines in the future. Some people worry about ingredients. So just to let you know what little bit of something is in these vaccines so far. This is actually from their package inserts. I didn't expound on lipids because that gets real chemical, but all that's in these vaccines is the messenger RNA that's coded to the spike proteins on the virus. Lipids are fats, which basically help the vaccine to move into your cell cytoplasm, where your cell can begin to reproduce and make the antibodies. It doesn't go into the nucleus of your cells, and it doesn't change your RNA or DNA patterns or change anything about you. And actually, a lot of what goes in this messenger RNA that's coded actually disintegrates over time. There's nothing left behind. It's just that it triggers your immune system to make the magic antibodies that fight the disease. And because it's coded to the spike proteins, this new variant that you're hearing about is just as affected by this vaccine as the strains we've had so far, because the mutations happen within the viral DNA or RNA and not in the spike proteins. So that's another reason to get this vaccine, is it doesn't just protect you from what's going around now, it'll protect you from other variants of this virus that develop in the future. So you've got the messenger RNA, the lipids, a little bit of potassium chloride, that's in medicines all the time, a little bit of monobasic phosphate, potassium phosphate, a little bit of sodium chloride, and a little bit of sucrose. I mean, a little bit of salt, a little bit of sugar, and a little bit of fat, and messenger RNA. It's all in our body all the time anyway. And then there's no aluminum, no mercury, no food allergens, and none of the stuff that people worry about. People talk about side effects, and I like to clarify side effects. Side effects and things that we see are actually not side effects. They're your body's immune response to this vaccine. Most commonly reported side effects are injection site reaction or discomfort, a little bit of fatigue, a little bit of headache, some muscle pain in people. You might get a little bit of low-grade fever and chills. Some people actually get joint pain and aches. But again, this is called an immune response. It's a response without infection, and it's a good thing. It just means the shot's working. The only real reactions we worry about are those people that might have, severe allergies, severe anaphylactic reactions to shots. And just remember too, these are short-term and manageable and are significantly less risky than taking your chances with a COVID-19 infection. The other thing I like to mention to people is the difference between surviving and thriving. People say, why should I get vaccinated for a virus with a 99% survival rate? And these are just a couple of the reasons that I usually mention it. COVID-19 symptoms can persist for months. The virus can damage the lungs, the heart, the brain, which increase your risk of long-term health problems. Even young people and healthy people can feel unwell for weeks to months after infection, and we all know people that fall into that category. People are scared of mono because it makes you feel bad for 3 or 4 months. This is like mono on steroids if you're lucky enough to be a survivor. And you have a significant case. But again, organs affected can be your heart. Echoes and imaging studies have shown muscle damage to heart, increased risk of congestive heart failure, and other complications like arrhythmia in the future. We all know about lung damage from the virus. People have significant pneumonia and long-lasting damage to alveoli and scar tissue in their lungs that can lead to long-term breathing problems and poor exercise tolerance for life. And then there are brain things that are still being studied, but even in young people, COVID-19 can cause strokes, it can cause seizures, it can cause Guillain-Barré syndrome, which is a usually temporary paralysis associated with viral infections. A lot of people are familiar with the loss of taste and smell, but if you think about it, the nerves that allow you to taste and smell are direct branches from your brain. And I think that we will, with time, discover more and more about what that may mean down the road. But again, something to keep in mind is that they already think that having COVID-19 infection, those people that have brain effects, it may increase your risk of Parkinson's disease and Alzheimer's disease down the road. So those are reasons that, in my mind, it's important to get your vaccine and not just trust the disease to give you immunity, especially knowing now that with different variants, the immunity you get from a variant of COVID-19 protects you from that variant, but it doesn't protect you from new strains coming through. So people can get COVID again. Again, with this vaccine, from all we know about it theoretically, it should protect you from every strain of this virus, which is, again, all strains defined by the spike proteins on the capsule. So let's talk a little bit about getting your shot. Just wanted to mention, and again, this is changing with time, but CDC and people with a much higher pay grade than mine came up with a vaccination schedule that we're supposed to try to follow with phases, 1A, 1B, 1C, and then phases 2 and 3 to follow, and set up categories for people to get tested. And phase 1A initially was just healthcare personnel and long-term care facility residents and staff. Just as we were preparing for that, there was a government edict to expand with very limited numbers of vaccines and very little planning to jump this far this fast. But they added first responders, police, law enforcement, fire, citizens 65 and over, and their caregivers. And that starts Monday, the 11th. And that was at the request of the governor and state public health. So we're quickly and desperately trying to get in vaccines to address that group and prepare to expand further. But because group 1A, which I now call a modified phase 1A or 1A plus, is much bigger than it was initially and is going to take longer to complete than was initially planned as we reach out to the big group of citizens 65 and older. And just to give you an idea of what that means to us from a public health standpoint, in my 10-county area, based on the census in 2019, all of a sudden we had almost 28,000 more people to get vaccinated in this group. And in Lawrence County, again, that's about 8,600 people that were additionally thrown into this group of people to be vaccinated. So it's a big jump really fast. And I just show you that to beg for your patience. And it wouldn't be a public health presentation if I didn't very quickly talk about the things we should do. So just remember to wash your hands often. We all know those things. Avoid close contact. Again, keep your 6-foot distancing. Try to avoid gatherings of too much size and really follow public health guidance while you're involved in that. Cover your mouth with a mask, mouth and nose at all times. I like to say if you're outside your home, wear a mask. Cover sneezes and coughs and that sort of thing. Your mask will do that for you, but in the event that you're in your home or not masked, this just shows why you should always cover coughs, because that's what sprays the virus around. We know too that it's even aerosolized some as well, but always cover. And then I'll always do a lot of cleaning and disinfecting with wipes and particularly bleach and Lysol work really well, or comparable products. And then monitor your health and symptoms. I encourage you as employers, it's hard to deal with smaller workforces, but one of the best things you can do is to really be aware of the health of your workforce and try to screen and keep sick people out of your environment, because it's a lot better to have 2 or 3 out than to suddenly have 40 or 50 out, and for extended periods of time. So just keep those things in mind. And that's really all I had on slides, but would be glad to answer questions and might beg some help from other people in the room as well. I'm sorry.
For those that have had COVID, when would you recommend them taking the vaccine?
What's currently recommended by CDC is if you've had COVID disease, that at least you wait 14 days from recovery. So once you have no fever and dramatically improved symptoms or no symptoms, wait about 14 days, and you can get the vaccine that early. While the vaccine's in short supply, they're actually saying that if you can wait, that you can actually safely wait 90 days to get your vaccine. I personally, and a lot of people at CDC and state levels, recommend a good approach. You have natural immunity for about 90 days. So if you get your first vaccine on day 60, then you've got about another 3 to 4 weeks to get your second dose of Moderna or your second dose of Pfizer. So the earliest is about 14 days. The latest I would wait personally is about 60 days from the date of recovery.
there were different phases, phase 1, phase 1B, phase 1C. If you fall in one of those first opening phases that qualify you to get the vaccine, how do you get that scheduled? How do you call, get an appointment, go through that process?
It's been difficult across the state, and public health has never been designed to deal with this massive an influx. Public health has always been behind the scenes. Here locally, we're using our southcentralhealth.info site to try to do some registrations, and that's what we did for healthcare workers and the small targeted group to begin with. We're trying to put out information now about our mass drive-thrus, which are starting in Lawrence County next week. We're doing a big drive-through at Southern Pines on both Wednesday and Thursday for people 65 and over, or their caregivers or any stragglers in the healthcare setting. If your name starts with A through N, we'll drive through Wednesday between 9 and I think it's 3. And then on Thursday, for those people with last names starting with M through Z, they can drive through as well. So we're trying to get some mass vaccinations done that day. We've got allocated to those sites about 1,000 vaccines a day. And unfortunately, if we get more than 1,000 people, we'll probably have to stop. But again, addressing this large number of people all at one time is hard to do. Now, if you're in the 1B group, which begins to fall in, I hate to use the word critical infrastructure and all those words that indicate somebody's more important than somebody else, but there's a pattern that we'll follow to reach out to businesses and people that are assigned to 1B and 1C. We're still developing outreach. A lot of people have gone ahead and sent information in through our healthcare worker registration site, and we're making lists, but we'll begin to reach out more publicly as we get closer to that. It's been pushed back because of this large influx of people to be vaccinated, but stay tuned to our southcentralhealth.info site. I will say the Courier Herald's working really well with us to try to get information out. You can use that registration link to put in information, even though if you're not a healthcare worker or whatever, it will get your information to our people that are making lists and contact lists to reach out to people.
Dr. Kraft, if you, in your family, like my last name's Wilford, but my mother-in-law, who's 87, is Banks, to go through one of the drive-through, would I have to go through twice? One for a W, one for a B?
No. Will she be in the car with you?
She would be.
Yeah. As long as somebody in the car has a name that meets the criteria and then you're their caregiver, it'll be fine for you to go with her.
Let me say this too. Us being rural Georgia and then the bigger cities, are we getting the same kind of attention as far as the vaccines coming in?
Yeah, I think we've done a really good job of getting vaccines quickly. You know, people in Atlanta were a little bit upset that Savannah worked fast and got the first vaccines. You know, Atlanta people like to be first. But you know, because they used Pfizer vaccine and had ultra cold storage, and that was the first vaccine that came out. You know, the breaking news was that those two areas had vaccine and the rest of the state did not. But you know, that lasted less than 2 weeks, and that's because rural Georgia, because of lack of ultra cold storage, had to focus on acquiring the Moderna vaccine. We knew when that was coming in, and once that came in, things have moved quickly. Especially with the changes that have been made. So I think rural Georgia's done really well as far as allocation of vaccine. You know, a lot of that's based on two things. It's based on population size, but it's also based on how quickly you're using up vaccine. They're following that in GRITS, which is a state registry, so they know how many vaccines they give you, they know how quickly you're using it. When you place your order for next vaccine, they check to make sure you're burning what you've got before they send you more. But my staff works with GRITS all the time. Anyway, public health has always worked with vaccines, so we're getting good turnaround. I'm helping some partners in town to try to also make sure that their vaccine gets replenished quickly, and I'm working closely with one group now to try to help that out. But I think we'll have just as much availability of vaccine based on population size as the rest of the state will.
One last one.
Once you have the vaccine, when are you considered to reach immunity?
Okay. So if you get your first vaccine, and I forget the exact numbers, but usually after 2 to 3 weeks, you've reached the maximum of what that first vaccine will supply. and it's somewhere in the 70% protection rate. And then you get a booster at either 3 weeks for Pfizer or 4 weeks for Moderna. And after about 2 weeks from that, 2 to 2.5 weeks, you should reach that 94.5 to 95% protection rate that the vaccine provides. So it's important to note that when you get your first vaccine, you're not free and clear to go. You're not clear to stop your mask. You're not clear to stop your social distancing. And I ask that for two reasons. Number one, you're not protected, and we already have examples of people who get vaccinated and have already gotten COVID after the first vaccine. It didn't mean they got it from COVID. It meant they got it from the community. I mean, from the vaccine, they got it from the community. But even after full vaccination, there will be a time until we reach herd immunity that we're still going to ask people to follow public health guidance and to still wear your mask and to still, wash your hands and to still follow guidelines that will keep the whole community safe until we reach a level of agreed upon herd immunity and see rates really fall off. So model that good behavior. I think modeling that good behavior protects people just like, not as effectively, but still protects people until we get this thing beat. So help us be good models, help us to spread good word to your employees and your businesses. And as a last plea, I say there are only two things that are going to protect us from this pandemic. One is public health guidance, but the second one is the vaccine. So I hope that all of you will be involved as community leaders and business leaders and people who can make an impact in our community to get the vaccine, to feel like it's safe. And I can understand not wanting to be first in line, although I was as close to first in line as I could be. But I can understand that. But hopefully you'll see as people continue to get the vaccine and do incredibly well, and we have stats that talk about how minimal side effects are, and we see numbers fall. I hope that everybody will buy into the vaccination. There's no microchip. I'm not hearing voices in my head or anything along those lines. So I encourage people to realize that the only way that we're going to beat this successfully and not have this pandemic last for 2 or 3 or 4 years until it burns itself out, to strongly consider getting the vaccine and to please be part of encouraging people that you know to get the vaccine.
I know some of you may have to go or have a schedule. If you need to get up, that's okay, but I'm going to ask while he's here if Don Avery will come up for just a minute and give us a brief update on how things are going over at Fairview Park.
Just say, Tom, I can
Well, can you, Don, I need you to come here for TV and recording, because, and this is information we want to make sure everybody gets.
I want to add one thing to what Thomas said, and it was a great presentation. I hope you take what he said to heart. Trust the science and not social media. I get so tired of all the so-called experts on social media that are not experts, and we tend to listen to what Facebook or Instagram or CNN or Fox News says. Listen to the science, and the science says take the vaccine. I've had my second shot. I also have had I almost wish I would have had a side effect. I want to make sure my immune system is working. At the hospital, we're the busiest we've been since this started. Today we hit a high. Our last high was in July. I've been saying all along we're not going to hit another high, and we just did. We hit our highest point, and that's 50 patients, which is 40% of the patients at the hospital have COVID. The good news is they're not as sick. Fewer people are going into the ICU, and fewer of those people are on vents. People are still going to the ICU in some cases, and some people with COVID are still going on vents. And their mortality increases with those increased treatments, obviously. But right now, as I said, we hit 50 patients out of our 125 total. Do the math, that's about 40%. Our ER is very busy. We have had consistently this week more patients. We've had beds, which means some people are in the hallways. They're being cared for. Staff is caring for them. And the reason we've had the spike, obviously, is because of all the social gatherings through the holidays. And so, again, I emphasize what I've been emphasizing all along, and that is don't have all these social gatherings. And people say, well, it was just 10 of us or just 15 of us. We know that there's 25 people together in a room. There's better than 80% chance somebody has the virus. Do the math, you have 10 people, probably have somebody, it's about a 50% chance somebody has it. And just because they're your family, you don't know where they've been. You don't know who they've been exposed to. So just use caution. The hospital is very busy. And what happens is, people have a shorter length of stay. We discharge them, we're filling up the beds. But we may have to make a decision later today to start either reducing or stopping certain surgeries. For instance, this surgery I had yesterday, carpal tunnel, would have been considered a non-essential surgery, obviously. And so anything that's not emergent, we may have to stop doing those so we can repurpose staff to other places in the hospital that might need them. I hope we don't have to do that, but when I get back to the hospital, we're going to look at that this afternoon. So again, please use the caution that Thomas has said. So thanks.
Thank you again, Don, and thank you, Dr. Kraft, and thank you, Dr. Garner, to the Medical Center for sponsoring this program today. Want to let you know right now the plan is to move forward with a February first Friday, and why that's so important and what I want to tell you about that first Friday. Dr. Garner mentioned the blood plasma and how important that is. Shepherd Community Blood Center out of Augusta is a member of the chamber, and they're going to come back 2 times in February. They'll be out in our parking lot on 2 weekends, and they will be doing the plasma drive as well as the first Friday breakfast. They'll be doing a blood drive. So I want them to come and to talk to our citizens and our residents and let you know why it's so important and go through those procedures as to how that works. It's not quite as simple, if I'm correct, as just going to give blood. It's a little bit more extensive. There's some paperwork and pre-screening that has to be done, but they will be here in February to share that program, and they will be with you twice. So I wanted to share that with you. And with that, I want to tell you it's a great day for business in Dublin, Lawrence County. Thank you for practicing social distancing and wearing your mask this morning. And it's a great day for business in Dublin, Lawrence County. We're adjourned.
It's nothing personal. It's just business.
Hello?
That's how some people do things.
Right away.
To us, everything we do is personal. Because anyone can answer the call. It's who shows up that matters most. That's the quality of your independent agent and the company that stands behind them.
Ask Curry Maffett Insurance in Dublin if auto owners make sense for you.
It's really hot outside, and the deals are even hotter with the City of Dublin Natural Gas. How would you like a free 40-gallon hot water heater plus free gas installation? It's easy. Just pick up the phone and call Brad Grimes with the City of Dublin Natural Gas, 277-5048, and get a free hot water heater and free installation. The City of Dublin Natural Gas, saving you money every single day.
I know some of you may have to go or have a schedule. If you need to get up, that's okay, but I'm going to ask while he's here if Don Avery will come up for just a minute and give us a brief update on how things are going over at Fairview Park.
I want to add one thing to what Thomas said, and it was a great presentation. I hope you take what he said to heart. Trust the science and not social media. I get so tired of all the so-called experts on social media that are not experts, and we tend to listen to what Facebook or Instagram or CNN or Fox News says. Listen to the science, and the science says take the vaccine. I've had my second shot. I also have had I almost wish I would have had a side effect. I want to make sure my immune system is working. At the hospital, we're the busiest we've been since this started. Today we hit a high. Our last high was in July. I've been saying all along we're not going to hit another high, and we just did. We hit our highest point, and that's 50 patients, which is 40% of the patients at the hospital have COVID. The good news is they're not as sick. Fewer people are going into the ICU, and fewer of those people are on vents. People are still going to the ICU in some cases, and some people with COVID are still going on vents. And their mortality increases with those increased treatments, obviously. But right now, as I said, we hit 50 patients out of our 125 total. Do the math, that's about 40%. Our ER is very busy. We have had consistently this week more patients. We've had beds, which means some people are in the hallways. They're being cared for. Staff is caring for them. And the reason we've had the spike, obviously, is because of all the social gatherings through the holidays. And so again, I emphasize what I've been emphasizing all along, and that is, don't have all these social gatherings. And people say, well, it was just 10 of us or just 15 of us. We know that there's 25 people together in a room. There's better than 80% chance somebody has the virus. Do the math, you have 10 people, probably have somebody, it's about a 50% chance somebody has it. And just because they're your family, you don't know where they've been. You don't know who they've been exposed to. So just use caution. The hospital is very busy. And what happens is, people have a shorter length of stay. We discharge them, we're filling up the beds. But we may have to make a decision later today to start either reducing or stopping certain surgeries. For instance, this surgery I had yesterday, carpal tunnel, would have been considered a non-essential surgery, obviously. And so anything that's not emergent, we may have to stop doing those so we can repurpose staff to other places in the hospital that might need them. I hope we don't have to do that, but when I get back to the hospital, we're going to look at that this afternoon. So again, please use the caution that Thomas has said. So thanks.
Thank you again, Don, and thank you, Dr. Kraft, and thank you, Dr. Garner, to the Medical Center for sponsoring this program today. Want to let you know right now the plan is to move forward with a February first Friday, and why that's so important and what I want to tell you about that first Friday. Dr. Garner mentioned the blood plasma and how important that is. Shepherd Community Blood Center out of Augusta is a member of the chamber, and they're going to come back 2 times in February. They'll be out in our parking lot on 2 weekends, and they will be doing the plasma drive as well as the first Friday breakfast. They'll be doing a blood drive. So I want them to come and to talk to our citizens and our residents and let you know why it's so important and go through those procedures as to how that works. It's not quite as simple, if I'm correct, as just going to give blood. It's a little bit more extensive. There's some paperwork and pre-screening that has to be done, but they will be here in February to share that program, and they will be with you twice. So I wanted to share that with you. And with that, I want to tell you it's a great day for business in Dublin, Lawrence County. Thank you for practicing social distancing and wearing your mask this morning. And it's a great day for business in Dublin, Lawrence County. We're adjourned.
At Morris Bank, we understand that your personal finances and banking experiences can be stressful. We also know that it doesn't have to be that way. That's why for over 60 years, we've dedicated ourselves to providing common sense banking to people just like you. We work hard to combine the latest online mobile technology and top-notch customer service that allows us to do just that.
We realize our customers have choices, but what sets us apart is the personal service that we provide that they may not receive at larger institutions. We like to make you feel at home, and we like to make the process as easy as possible when you're banking with us.
But we're not focused on helping just our customers. We are equally dedicated to supporting the community we are a part of. Just this year alone, we've logged thousands of community service hours and provided significant financial support to the communities we serve. We want to make sure you have the best banking experience possible. Come see us or give us a call to find out what makes Morris Bank different, because we're banking on you.